Hi there. Just doing a video on the high flow nasal cannula. A lot of people have had questions about when we would use it and how to properly use it and how to wean somebody off of the high flow nasal cannula. So we're going to touch on all of those topics. First, to start off with, who would benefit from a high flow nasal cannula? If you've got a patient who is in respiratory distress, but maybe they're not retaining a bunch of CO2, they're not really BiPAP worthy, or maybe they don't tolerate the BiPAP, and we want to still give them that pressure, give them that good flow that's going to help reduce that work of breathing, they would qualify for the high flow nasal cannula. If you have a patient who has a high oxygen demand, despite putting them on oxymask or a non-rebreather, or maybe they've been on those long enough and they're just, they get claustrophobic, they don't like having something on their face, a high oxygen demand, they would benefit from a high flow nasal cannula as well. Other applications that we've used it for would be, since it does have heated humidity, someone who needs that moisture in their airway, someone who's been suffering from some nosebleeds or some really dry membranes from being on the other oxygen devices. This would help them out. We've also put it on patients who have had a hard time clearing secretions despite us doing CPT on them or them having a flutter to work on their own. We've done the heated moisture with a mask or the nasal cannula to allow them to get that extra moisture within their airway and hopefully loosen up those secretions as well. Okay, so that's who would benefit from it. It is covered under our oxygen orders, so technically you do not need to have a separate order for a high flow nasal cannula, as it is covered under the oxygen administration order. However, I do always like to ask the doctor, or at least confer with the doctor before I go and put it on the patient, just to make sure we're on the same page as far as the treatment of care. Okay, so this is the high flow nasal cannula. You'll find it in the storage room in the ICU, and it will be covered with a bag. We always got to keep our equipment covered. So when you pull it out of there and you bring it to the patient's room, first thing you're going to want to do is you're going to want to plug in the oxygen line. So just plug that into the wall. You're also going to want to plug in the power for our heated humidifier, okay? So the only thing that takes power is the humidifier when you're using this. Next, I like to turn on our oxygen analyzer, which is right up here, the on-off button there. And that's just going to tell you what percentage of oxygen you're giving. So I turn that on so I know what's going on. And I've got my hose here. The hose has a heated wire. Okay, so this wire will determine what the temperature is, tells us the temperature on the humidifier so we know we're not making it too hot for our patient. So that's this is the temp probe right here. That's the whole purpose of that, is to tell us the temperature. Right down here is our humidifier, and we'll talk about that shortly. But this is the hose that's going to connect to whatever device we're using to put it on the patient, whether it be the actual nasal cannula, which I'll show you shortly, or even simply just an aerosol mask. Our mask, like we use with a nebulizer, hooks right in here, and you can strap that to the patient's face if they would prefer a mask. So that's an option as well. So next I'm going to pick out a mask for my patient, or not a mask, excuse me, a nasal cannula for my patient. And they come in 3 different sizes. We've got small, medium, and large, okay? So with these, most people, at least with this ResMed brand of mask, I have found most people are going to be a large. And basically you want to make sure that the prongs within the mask fill 3/4 of the nair. Which this brand runs a little small, so like I said, most people would end up being a large. There are also little guides here along the top for measuring your patient as far as what size they would be. So you can just simply stick it by the nairs to measure your patient. Okay, so you're going to find their size, take it out of the package, and hook the only end that would possibly fit from the nasal cannula into your tubing. Okay, and then I would put it right on the patient at that point. And now I'm going to start by turning on my flow. Okay, So there's two knobs here, and let me switch to the other side here so I can not have my head in the way. There's two knobs. The top one is the oxygen knob, and you can see that along the side here it does say O2. Bottom one is the flow. So first I'm going to start off by turning my flow on. I never want my flow to be less than 15 for sure. Typically I don't like to go less than 20, just because once I'm at 20 I should have weaned my oxygen enough to where I don't need to be on this device anymore anyway. A person could switch to the green high flow nasal cannula or even a regular nasal cannula. Okay, so turn on my flow. Typically, as I'm getting the patient used to it, I'll start at like between 30 and 40 liters a minute, which sounds like a lot, but when you've got the large bore tubing and the large nasal cannula, it does make that pressure a little more tolerable. Okay, so I'll turn up my flow, and I also will turn my oxygen to whatever I need based off of the patient's sats on the monitor. Now, the oxygen is not going to be a precise dial, because as I adjust my flow, my oxygen will adjust as well a little bit. So don't set it at 40 and think it's always going to be at 40. You may come in a little while and it's reading 38, or it may be reading 42. So don't think it's always going to stay. And as you adjust your flow, your oxygen will waver a little bit too. So you may need to fine tune that when you make adjustments. But I'm going to turn on my flow to between like that 30 and 40, and then I'm going to turn my oxygen on to whatever the patient needs based off of their saturations on the monitor. Okay? So I've got it on my patient's face, the nasal cannula, the prongs are in the nose, and the headpiece is holding it on. So this is all over at my patient. Now I want to give them some humidity, because nobody wants 40 liters of flow going through their airway without some humidity. So I've got my water bag up here. I'm going to take it out of the package, and I'm going to take this device right here, and I'm going to puncture the green side of my water bag. Okay? Once I've punctured it, the water should fill into this reservoir here, and then I can turn on my heater. When I turn on my heater, it'll make a beep. There we go. And I've got two options. I've got invasive, which you can see, obviously if you're a little closer to the machine, you can see it's a picture of a person with an ET tube down in through their mouth and in their throat, or non-invasive, which has a patient with a mask. I would put this on non-invasive so it doesn't get too hot for your patient. You will find COPDers do not typically like a lot of heat, so they may not tolerate any heat with it. I do try to do at least a few hours on, a few hours off with the heat with patients, just so that we don't dry out their mucous membranes. But to change this from invasive to non-invasive, because it automatically turns on to invasive, I just hold down this button and it beeps and the light changes to being non-invasive. Okay? Invasive is 37 degrees Celsius, non-invasive is 32 degrees Celsius. And it does take a little while for this pot to heat up and get the sterile water heated to the right level, but it will. Okay, so I've punctured my water bag, I've got moisture going from my patient, I already put the nasal cannula in their nose, I've set my flow, and I've set my oxygen using these knobs. We have taken and put a green piece of tape on the oxygen knob, just because green usually makes us think of oxygen. So that way you know which one it is also, besides just looking at the O2 and the flow. Okay, so now I'm going to monitor my patient. I'm just going to monitor their work of breathing. I'm also going to monitor their saturations and make sure that these are set accordingly so that they are getting relief in their work of breathing and their saturations are in the desired range based off of their oxygen order. Now when it comes to the weaning stage, if your patient's been on this long enough and they've gotten the benefits of it, the first thing I want to do is I want to wean my oxygen. Now, a lot of times people are on some pretty high flows with this, and they're also on some high oxygen concentrations. So I want to wean my oxygen, and I typically like to wean my oxygen down to between 40 and 50% before I consider switching devices to, say, an oxy mask or even a nasal cannula. So that's what I do, is I typically wean to that 40 to 50% and then I switch devices. Also, when you're weaning, I wean the oxygen first, and then once I get to that 40-50%, then I'll start decreasing my flow, okay? And once I get to a flow of about between 20 and 30, then I can consider stopping and switching to a different device. You will find that a lot of your patients really do like this. It's more comfortable for them. They definitely need that moisture because otherwise it does sting a little bit in the nares. But they do feel some relief because with the high pressures, it does create a little bit of a CPAP type effect within the patient's airway. So even if they didn't tolerate necessarily CPAP or BiPAP, they may tolerate this, which we kind of dub as kind of a makeshift or a poor man's CPAP. So that is an option for those people. Also on here, there is a filter and there's also a muffler. If I take this off, it gets a little more noisy. So hence, that's why we have that, so that patients don't have to listen to that loud roaring when they're in their rooms trying to sleep with this device and everything in place. So that's all for now about the high flow nasal cannula. If you ever have any questions, please feel free to contact RT. We'd love to answer your questions about it. And if you're ever setting one up, feel free to reference this video as far as how to set it up and what all you need to look for when you're doing it. Thank you.